We're going to be palpating the maxilla. So I'm going to be kind of looking at below the eyes and around the sides of the nose here. So I'm going to start on one side. I'm actually going to be starting just below the orbit. So the maxilla is going to be meeting up with the zygomatic bone right through this area, zygomatic. And then the maxilla is going to be the infraorbital margin, more on the medial aspect of it. And that's going to round all the way up towards the frontal bone and the nasal bone. So this is technically right where my finger is, right to the inside corner of the eye, the frontal process of the maxilla. I'm feeling along the orbital margin with my finger until I meet that zygomatic bone. Just underneath it, I'm going to sink in. It's a little bit more medial than it is lateral, but I'm feeling for another little pocket or a pit. This is a foramen right here, so I've located it. And this is below the eye, so this is the infraorbital foramen. And just like the supraorbital foramen of the frontal bone, if you gently rest your finger, you will feel a light pulse in this area. Again, take caution that you're not going to push too hard because there is a nerve coming out from that same foramen. Palpating all along the outer edge of the nose. I'm going to go through the nose just briefly here, just so you have an understanding that this is cartilage that I'm moving back and forth. So it is dense cartilage. However, it still can be a little bit more mobile, and when you follow that up, you will be able to find where the cartilage meets the nasal bone. So on either side, this is nasal bone versus this is maxilla versus this is kind of the frontal bone, more up in this location here. So down along the outer side of the edge for the maxilla. And as I get in below the nose here, what you want to kind of think about is your four front teeth are known as your incisors. So I'm actually going to go just to the bottom of her nose. I'm going to lift up on it. This is quite sensitive for a lot of people, but if I go left and right, if you go just in the side, this is known as your anterior nasal spine. So that's going to help anchor some of that cartilage. Just be very careful because it is quite sensitive. And below that, and lateral to it, one on either side, here and here, this is known as your incisive fossa. So your four front teeth are known as your incisors, and above the two on the left here, we have an incisive fossa, and obviously the same on the right. As I go lateral from the incisive fossa, I should feel a raised area, and this is for your canine, your third tooth over. So this is known as the canine eminence. So that's right in this location right here. And if I fall off of the canine eminence laterally, I'll end up in another pocket, which is known as the canine fossa. So I'm going to repeat those three one more time. Just above the front two teeth here, we have an incisive fossa on the left side. Then I have the canine eminence over the third tooth. And then I have the canine fossa. Now, if you were to kind of palpate and go back and forth over all the outer edges of the teeth, these are all known as alveolar processes. And basically you can think of that as a tooth socket. So each one of them has its own alveolar process, but I'm just feeling the external part of it, where you have to go inside the mouth to be able to kind of pinch it to feel the whole structure. So again, incisive fossa, canine eminence, canine fossa, as well as palpation all the way along for alveolar processes. And that's really going to conclude all the major landmarks of the maxilla that we're going to discuss right now.